A new offensive began today in the war on COVID. Hundreds of Defence Force personnel have begun helping police manage the outbreak in Sydney. Officials say they won't be used to enforce compliance. Instead, they'll help contact tracers do their job and provide support for those in isolation. Another 207 people have the virus. Less than half of them were in isolation while infectious. A man in his 90s from Sydney's southwest died in hospital. He's the 15th death during this outbreak. Tim Swanston begins our coverage.
The reinforcements are here and looking eager to help. It's defence turned home delivery for many of the 300 ADF troops in Sydney.
We'll be under the control of the New South Wales Police. We're not a law enforcement agency.
Day one was a measured approach. It had all the hallmarks of disaster relief. Hampers prepped and packed for people who are forced to stay home. The deployment will be largely logistical, supporting behind the scenes. But they were called in at a time to help police manage compliance.
If you think about 200 positive cases, then the work health do with contact tracing, that could be 1,000 doors we need to knock just on today's statistics.
But talks with multicultural leaders only began 3 days ago.
There's definitely anxiety around the presence of military on the streets because I think the messaging hasn't been cleared.
I don't feel comfortable and I don't feel that it's necessary.
Some fear the defence presence will stir anxiety in parts of refugee and migrant communities. Leaders say today's efforts are allaying some concerns.
They showed high profile in the area, but they also showed very respectful manners. If they continue the way it is, I think that's going to be welcomed by the community.
The Defence Force says it's very aware of concerns from multicultural communities here in southwest Sydney, but its troops are in more of a supporting role, like here in this pop-up vaccination clinic. It's unlikely they'll be directly speaking with people on the streets. The defence effort frees up police to focus on other compliance work. The force has gone to lengths to stress that's being done in both the west and east.
I get more complaints about the beaches and the numbers of people on the beaches than I do about any other single health order breach.
The deployment is 6 weeks at this stage, but could be lengthened if the lockdown sticks around past August. Tim Swanston, ABC News, Sydney.
And Tim Swanston is in Liverpool for us tonight. Tim, for a high-profile campaign, defence personnel are trying to keep a very low profile.
Absolutely. It's very unlikely that you'll see troops on these kinds of main shopping strips in southwest Sydney. Instead, you'll more likely run into them at vaccination clinics, these pop-up clinics that they're using their resources to try and assist New South Wales Health with to try and ramp up that vaccination effort. They're also going to be assisting contact tracers as they madly scramble and try and keep up with those high daily case numbers each and every day at this stage. Now, although there are those concerns from the multicultural community about the Defence Force and that kind of fear, some say if the deployment is successful, that it could perhaps build rapport between the two groups.
There's been a new COVID infection at Westmead Hospital.
Yes, that's right, Juanita. A staff member has tested positive. We understand that they worked about 3 shifts while infectious last week. Now, the health department has said that that worker was fully vaccinated. About 3 dozen staff members have been isolated as close contacts at this stage, and they have said that healthcare hasn't been impacted at this stage.
Tim Swanston reporting there. COVID continues to spread through an aged care home in Sydney's inner west. 18 residents have now been infected, and it's emerged that the outbreak happened during a Christmas in July lunch. Here's state political reporter Ashley Raper.
An entire floor of residents is transferred to hospital as the virus spreads within a Summerhill aged care home. The outbreak started at a lunch.
Sometimes it's not a good idea to have a Christmas in July right in the middle of a pandemic.
A student nurse was infected and now another staff member and 18 residents have tested positive. Most residents are vaccinated, but 10 are not.
Of those 10 who for various reasons refuse to be vaccinated, 7 are positive, 7.
Last week's outbreak within Liverpool Hospital has claimed a life. A man in his 90s has died after being infected on the geriatric ward. The number of new cases remains more than 200. Only about half can be linked, and at least 51 cases were infectious in the community. Cases have closed Strathfield South Primary School and St Bernadette's at Castle Hill.
How realistic is it that children go back to school this year?
Look, it really depends on the numbers.
Can you rule out school not going back until 2022?
I can't predict the future, but I certainly am confident that schools will go back before then.
In the meantime, the Premier continues her vaccination push.
Next one.
In Cabramatta, they've answered the call.
I had my Pfizer booking at the end of August, but decided to maybe give that up to someone that's a bit more hesitant.
This pharmacy officially received 300 doses of AstraZeneca to administer over 2 weeks.
We actually finished all 300 doses within three days. So luckily enough, we were able to borrow some from our neighbouring suburb pharmacies.
Venues New South Wales wants a vaccine passport to allow admission to stadiums.
It would be a great way of getting crowds back at venues.
The Premier insists we are nowhere near that point. Her priority is meeting vaccination targets to ease restrictions. There's been an obvious shift. Getting to 0 cases in the community is now no longer the only trigger for ending this lockdown.
If the health experts give us advice to say vaccination rates are at a particular level, case numbers are at a particular level, which means we can have some level of freedom back, that's a positive.
It's just not clear what that advice would be.
Look, I think it's all too premature. Can I just say, myself and the team are just focused on breaking the back of the community transmission.
And that's proving difficult. Ashley Raper, ABC News, Sydney.
Communities along the Murray River have been caught by surprise after Victoria tightened its border bubble rules. There are now only 6 reasons that local residents can enter Victoria, including essential shopping, getting vaccinated and playing sport. The new rules come into effect at midnight tonight.